Hi, I'm Matt Overstreet from QCTV, and welcome to QCRx. Now, this is a show where I get a chance to talk to some people who are in the medical profession about some things that affect our day-to-day lives. Joining me in the studio today is Dr. Dan Kessler, and he's a doctor of psychology. We're going to be discussing the benefits of being mindful and mindfulness in general. Also with me today is Susan Nygaard. She's a registered nurse, and she's going to be talking to us about some ways that we can reduce stress. Finally today with me is Megan Odell. She's a licensed acupuncturist, and she's going to be talking to us about some ways that we can maybe break away from what we can traditionally think of as unhealthy American ways. We're going to dive right in. So my first guest today is Dr. Dan Kessler. He's a doctor of psychology, and our topic is mindfulness. So again, thanks for joining me today, Dan.
Very welcome.
Mindfulness, when we say it aloud, it sounds kind of lofty, kind of like a lofty topic. Can you maybe make it a little bit more concrete for us?
Mindfulness really is just being in the moment. We typically don't take enough time just to pause and be where we are and aware of our surroundings. We get very caught up in the world around us, and mindfulness just takes us out of that and puts us in the present. Mm-hmm.
So being in the present, that would you say that's the goal of it, or are there other goals?
Really, the goal of mindfulness is to be where you are, to help you make better decisions, to help you make better choices in life, and not get caught up and pulled along by the technology and by the hubbub of our daily lives.
Our daily lives. What is it about our daily lives, would you say, that makes this such a necessary practice?
Mindfulness has been around for as long as people have been around. Meditation, relaxation, these are all mindfulness techniques. In our current era, we have so many distractions. We have screens everywhere. I brought 2 devices with me here today.
Right.
I have another few devices at home, and we're always somewhere else. Mm-hmm. Mindfulness is often just that practice of setting those things aside and being where you are. Mm-hmm.
If somebody were to take up such a practice, how much time out of their day would that take?
If you're going to kind of practice it to get better at it, I tell people to take 5 or 10 minutes to do some mindfulness exercise, and there are mindfulness exercises we can find all over. But just that 5 or 10 minutes of set aside practice time, but then practicing mindfulness throughout the day, mm-hmm. In meal times, setting aside our devices and enjoying conversation, or just taking a moment to taste the food that we're eating rather than just moving through the meal as quickly as we can to get onto the next task.
It almost sounds like once you're used to practicing this sort of thing, that it is something that you can just kind of carry with you throughout your day.
Right, you incorporate it into your day in little micro practices all throughout the day, just stopping and noticing the sunset.
Nice.
Is a mindfulness practice. You're noticing the colors in the sky. You're taking the time out to be present and not someplace else.
Just in the moment. Yeah, absolutely. Now, you had written an article about this topic that I read, mm-hmm. and in the article you mentioned at least 5 different ways that you can practice this sort of thing. Mm-hmm. So let's touch on maybe a few of those.
Sure.
One of them you mentioned is sensory-based practice. Can you tell me a little bit about that?
It's really the first technique I teach patients when I'm working with them on mindfulness. It's taking stock of each of your 5 senses. I tell people to pause and hear the sounds in the room, to look around and notice what they can see, to take in the smells, to feel the chair they're sitting in, and to just take notice of each one of those senses, to notice the feeling of your feet in your shoes, to notice the feeling of your collar and your neck, or your wristwatch on your wrist. Things that come and go from our daily consciousness that we're not even aware of, mm-hmm. but to take a moment to become aware of all of those senses.
Things that we may normally, like you say, feel, but just momentarily, or ignore even.
We're being bombarded by thousands of bits of information at all times from each of our senses, and we tend to ignore most of them. Taking a moment to notice those senses, taking a moment to notice each one of them really brings us into the present and centers us and allows us to live a calmer, more pleasant life.
A lot of the things that we were just talking about were kind of physically based. Mm-hmm. You also mentioned some emotional based practices that we can be ways that we can be mindful.
Sure.
What are some ways that we can do that?
Just noticing our emotions. When you get home after a long day at work, if you take a moment to notice, gosh, I'm a little keyed up, I'm a little irritable, I'm a little anxious, it's going to help you when you're dealing with your spouse or your kids, because we carry our day home with us, and if we're aware that maybe I'm a little bit annoyed or frustrated because of stuff that happened today, I'm less likely to carry that into my interactions with my spouse or my kids. If we notice, right now I'm feeling this, I'm feeling a little anxious, or I'm feeling a little tense, or I'm feeling happy, it's gonna influence just the way we interact with the world around us.
So just acknowledging those feelings is one way that we can potentially, keep them from maybe manifesting in some less than helpful ways.
Sure, and accepting, mindfulness is about acceptance of those things.
Right.
Oh, I'm a little anxious right now. That's all right. I'm feeling kind of angry right now because of something that happened, but that's okay. I'm going to be aware of that and not let it rule me, but also not try to shove it away, because it's okay to have those feelings.
Now, I wouldn't feel right with myself if I let you go without talking about one of my favorite ones so far, which is urge surfing. So tell our viewers a little bit about urge surfing.
Urge surfing is kind of interesting. What we tend to do when we get an urge that we don't like is push it away. I see a cookie and I go, oh, I shouldn't eat that. And I try not to think about the cookie, and I try to distract myself so the cookie's not there. But really, we can't not think about things by pushing them away. If I tell you, don't think about polar bears, don't think about a white polar bear
then
wandering
across. That's the thing I'm going to be thinking about.
It's going to pop in your head. You can't push it away. On the other hand, if you allow the urge to be present, I know I love that cookie. That's a really delicious looking cookie, and it smells really good, and I like it. And it's okay to want it, and it's okay to choose not to have it. I don't have to push it away. And I don't have to distract myself. I can just accept that it's there and that I want it, and then I'm going to choose not to have it. And really, that's what mindfulness is about. It's sort of accepting these feelings and sensations and being in the moment without allowing it to rule you, without shoving it away, without having to look away, but just allowing it to be and accepting.
Acknowledge it, accept it, and then, that's wonderful. Well, once again, we're not going to be able to touch on all the different practices that you recommend, but there are some great practices I would recommend for any viewer out there that gets a chance to definitely check out the article that Dr. Dan has written on the Alina website. Once again, we'll put up a graphic for you for that. But Dan, did you want to leave us with any final thoughts on the topic?
Just to take time out of your day. It doesn't take very long, and just be present in the moment. Set aside the device, set aside the hubbub of life, and notice what's going on around you.
I can't think of a better advice than that. So once again, Dan, thanks for being with us today. We always appreciate you.
Thank you for having me.
We're going to have a little more after the break.
What I think is a common issue for a lot of people is that it's hard to prioritize sex because there is so much going on in our lives, and we're so scheduled and so busy that we're really tired, and there's research to show that we're just not getting the kind of sleep that we used to, the quality and the quantity. And so one of the first things that tends to go at that point is our sex lives. It just becomes lower and lower on the list of priorities. And so a lot of people who come to see me have this issue of being too tired for sex and just not having enough time for it or energy for it. So one of the things that we talk about is looking at, are there some things that you can do to take a couple of activities or obligations out of your schedule that maybe are not necessary so that you can make more room for prioritizing sex with a partner? I think first addressing that there's a discrepancy between one person's ideal time versus the partner's ideal time, and coming up with some negotiation or some ideas for maybe we do some swapping, or maybe, I'm not a night person, so I'm going to take a nap so that we can prioritize having this time together later in the day. Or we're going to put on an alarm and wake up a little bit earlier on the weekend because that's a great time for us to be intimate together. And so I think it's just coming and looking outside of the box at what are our options, and maybe sometimes doing a little bit of negotiating that, I'll take a nap this time and stay up late for you, and maybe you're willing to get up a little bit earlier for me, and just kind of getting a sense of what times work best. In order for something to be a priority, you have to make it a priority. And so it may not seem intuitive, but scheduling things that are a priority and making sure that they're happening is the best way to make sure that it actually is followed through.
And we're back to QCRx. My next guest is going to be Susan Nygaard. She's a registered nurse and public health nurse. So thank you for joining us today, Susan.
Thanks for having me.
Now, we're going to be talking today about reducing stress with guided imagery. Is that correct?
That is correct.
Everybody seems to experience stress. What ways can that affect us?
Sure. So first of all, stress is it's either a real or perceived threat that all of our bodies experience. And so years ago, back in the old cave days, it was the saber-toothed tiger that would come at people, and they had to fight or flight. So either you had to attack and come back at that tiger, or rescue yourself and get away, run away. Fortunately, today, we don't have saber-toothed tigers. However, we still have quite a few stressors out there. And the problem is our bodies are staying in a stress response for far too long. And we're not coming back down and getting back into an equilibrium state after that. So,
yeah. What are some not so evident ways that stress may be affecting us?
Sure. So stress affects people differently. So when you're younger, maybe 3, 4, 5 years old, stress is very different from when you're in your 30s or in your 70s. Everybody experiences a little bit differently. Many people think that maybe the upset stomach that they're having or the trouble sleeping that they're having is related to maybe a digestive issue or some other insomnia issue, but often it's related to stress and just different how our body over time, if you stay in that stress-free state, constant state of stress will affect you.
So these stressors may actually manifest as physical?
Absolutely.
Okay.
Absolutely. So headaches, dizziness, just irritability, trouble sleeping, all kinds of issues are a result of stress.
That's
and the chronic time, if you're in that state of stress, it will result in attributed to heart disease and diabetes, cancers, other things can be attributed to stress.
Certainly serious business.
Yes.
So guided imagery or visualization, that's one way that people can help maybe minimize the effects of these stress. Is that correct?
That's correct.
Can you tell me a little bit more about that?
Sure. So it's one technique that you can help to reduce your stress. And young and old can use this practice alike. And so if it's thinking about maybe the high school student that's on a sports team, whether it's basketball or swimming or track, they can use visualization and basically go through step by step. So the first step would be to just take some time to take some deep breaths, get into a calm, relaxing spot, and then picture your upcoming event, whether let's pick, for example, a cross-country meet. And just from the point of the gunshot for the start of the race, all the way through the bends and twists of the race, and then to the end of the race when they cross the finish line, they can take themselves there visually in preparation for an event and be much more successful. Likewise with adults, if we've got an upcoming meeting or other things that are stressing us out, running yourself through that practice can be helpful. Hindsight is 20/20. We've heard that phrase many times, and it is true. Looking back on yesterday, we can think about all the things that caused us stress and things that we did with it, but if we can bring ourselves to the end of an event and look backwards, we can often project more of a better outcome from that.
And then maybe that can help inform the future too, or when is a good time to practice a guided imagery?
Sure, guided imagery or visualization can be done pretty much anywhere at any time. So it could just be you come home from a day of work, all stressed out, just many things didn't go your way, and you can just take some time to relax and figure out what is that happy space. Is it a vacation that you went on and you're picturing a beach or somewhere else that you would just love to be and feel, what are the sounds, the sights, the smells? Is it the wind, the breeze in the air, the ocean rolling through? Or are you more of a winter person and you like kind of that cabin life and snowshoeing? Just taking our time to bring ourselves into that state and helping our bodies relax.
This is a fascinating topic, and I would maybe, if you could tell our viewers where they could learn more about it.
Yeah, Align Health has created a website, and it's called Change to Chill. And so it's basically changetochill.org is the website.
Okay.
And it was designed with a teenage mind in focus, and it's designed for teenagers. However, all adults can find many resources there. So from guided imagery to meditation to mindfulness, mindful eating practices, there's videos, activities, a variety of resources. And anybody that has access to the internet has access to this free website.
Great. Well, once again, thank you so much for being with us today, Susan.
You're welcome.
We always appreciate talking to you. I'm visualizing myself on that beach right now.
Sounds good.
We're going to take a short break. We'll have some more right after the break. If you're a history buff with an interest in local history, then check out It's Your History on QCTV Channel 15 and on the web at QCTV.org. It's Your History is produced in conjunction with the Anoka County Historical Society. We interview experts on local history as well as people who were there when it happened to bring you the most up-to-date facts on historical sites and events. So join us for It's Your History right here on QCTV Channel 15 and on the web at QCTV.org.
Something that I think is a challenge for a lot of people is to establish and hold on to healthy boundaries within interpersonal relationships. And so what can end up happening is that we don't follow our own boundaries and we end up feeling resentful or angry towards someone because we don't feel like we're getting our needs met. And so it can be really hard to communicate what a boundary should be or what it needs to be for our own needs. And it can also be very challenging to find the language to put that together and what's the template for how to set that up in a most effective way. And so what I really encourage for people is to follow a couple of simple steps. One is to state what you notice is happening. So state the facts, state the information. You know, I noticed that you just said such and such. And when you said that, the next step would be, how do I feel about what you just said? So you just said this, and I'm feeling this way. And then third, you want to talk about what you're needing. So what I need is for that to be said a little more gently, or what I need is for us to take a break so that I can gather my thoughts, or what I need is for whatever it is that you're needing to be a bit different for you to feel more open to that interaction. And then finally, to set some sort of consequence to, if this doesn't change, then I might have to make certain choices based on the fact that that's not changing. So, you know, I think the thing that people get confused about is it's not really about controlling somebody else, but it's about saying, here's what my limits are, and here's what I need that to look like and how to be respected. And if it's not, then I have to make certain choices based on that information. I think, you know, if you learn more effective ways to communicate your boundaries, what that could look like is having less defensive conversations, having more connected conversations, feeling more respected by your partner or people in your life, and for them to also feel like they're being respected by you as well.
And we're back to QCRx. Well, my third and final guest today is Megan Odell. She's a licensed acupuncturist, so I want to thank you, Megan, very much for joining us today.
Thanks for having me.
Now, you wrote an amazing article about breaking away from traditional American, some unhealthy American ways. And in the article, you kind of talk a little bit about traditional Chinese medicine and Western medicine. So could you help us maybe delineate a little bit between the two?
Sure. Well, there's a lot of differences between the two.
I imagine.
But I think the most important and foundational way is simply in how we think of the body. Western medicine tends to be reductive, so it tends to narrow down everything that someone might be experiencing to try and figure out what's the one thing, what's the diagnosis that we're going to give this, and from that, then they can create what the treatment's going to be. In Chinese medicine, we look at it a different way. We look at the entire person's body, body, mind, spirit, everything, thinking of the whole body as an ecosystem. And then through that, we can start to figure out, is there a pattern to what's going on within someone's life? And can that give us a way to treat the person?
And you say traditional Chinese medicine tends to look for a pattern. What's the difference between a pattern and what we would normally say in Western medicine as a diagnosis?
Well, yeah, it's basically a pattern is our word for diagnosis. So again, where they come down to that, what's that one thing? We're looking at what's the pattern between the different symptoms that someone might be having. So not just looking at the headache that they might have come in with, but also what's happening with their digestion, their sleep, their mood, other painful spots within the body. All of those things can give us clues about, is there some sort of an imbalance that's going on in their whole ecosystem of their body? And then ultimately what we'll be doing is coming up with a treatment plan to try and bring balance to the whole body, not just the one symptom that they're coming in with. So often people will say, oh, in addition to my headaches being gone, I'm also sleeping better, my mood is more even, my digestion is better, because we've brought balance to the whole system.
That's fascinating. Now, you mentioned that your professor of acupuncture had noticed, who is obviously a practitioner of traditional Chinese medicine, there was a particular pattern that he kept noticing over and over with a lot of his American patients. What type of symptoms first of all, can you talk a little bit about that pattern, and then what sort of symptoms presented with it?
Sure. I'm gonna get a little bit crazy with the lingo here, just because Chinese medicine, we use different words for these things, but I'll explain it.
Okay.
The pattern is actually called liver-spleen disharmony, and we're not talking about necessarily the liver and the spleen as these functional organs within you, but we're talking about the functions that the Chinese attribute to those different organs. So the liver is responsible for the free flow of energy throughout the body, making sure that everything is moving the way that we want it to. And the spleen in Chinese medicine is primarily responsible for digestion. So liver-spleen disharmony simply means, how does the digestion interact with the flow of energy throughout our body, and vice versa? Does that make sense?
Absolutely, and I keep noticing that once again, harmony seems to be the operative word here. That seems to be the goal that we're headed towards. What would you say it is about our normal American life that lends itself towards this particular type of pattern?
Well, it's hard for me to say since I'm living here within this culture, but he observed that every patient that he saw, well, maybe not every patient, but many of the patients all show up with this. So that made me start to think, okay, what is it about our lifestyle that is bringing this on? And I'm thinking about, even as I drove here today, I'm driving here, I'm trying to get here on time, I'm dealing with traffic coming this way and that, and noticing my own body starting to tense up. And so within that, you start to think, okay, the energy in my body is not flowing very well right now. And so if I'm doing that day in, day out, how is that going to eventually manifest for me physically? Some people might start to experience it as headaches. Some people might experience it as chronic pain in their neck. There's a whole host of other things that people might experience. So it's that go, go, go sort of an environment that we have here on the roads, at work, with our families even perhaps. We also live fairly sedentary lifestyles. So again, lack of movement, right? If we're talking about trying to flow the energy in our body, we're not moving. We're sitting at a computer screen for most of the day. It also could be our foods, the foods that we choose, and then also how we eat that food. Are we eating food in a fast way? Are we eating while we're driving or while we're looking at our computer screen? We're not sitting and savoring the food. There's a lot of things within our lifestyle here that I think contributes to this being something that I see over and over again in the clinic.
Sure. And so for these types of particular types of ailments, what would traditional Chinese medicine recommend?
Well, keeping within the actual modality of Chinese medicine and some of the therapies that we provide for our patients, acupuncture is probably the go-to, but there's also Chinese herbs that we can bring on, and also dietary therapy, especially if that digestive piece seems to be showing up a lot for someone. We would talk about specific foods from the Chinese standpoint that could help to bring balance to the body again.
Sure.
But beyond that, probably the most important thing is taking a look at what you're doing when you're not with your Chinese medicine practitioner.
Right.
How are you approaching your day?
Right.
How are you dealing with your emotions and your moods? How are you eating your food? What foods are you choosing? Are you able to deal with stress within your life or not? Are there changes that you can make in that area?
Sure, sure. I noticed that when you were just talking about some of the potential treatments, some of them were more physical and some not so physical. Can you speak to that for a second?
Sure. In terms of the physical, I think we're talking about like exercise and acupuncture and things like that. Is that the delineation that you're making?
Yes.
And then there's others, the things that maybe have to do more with what our inner landscape is.
Okay.
And the thing to remember is that in Chinese medicine, we're not really making a distinction between those things because it's all a part of what's going on within your existence. And so both are equally important. How are you actually physically interacting with your world? But then also, what happens if a feeling arises? And to let yourself know that it's okay to feel angry. I feel like I spend a lot of times with patients sometimes saying, you know, it's okay to feel angry. You don't have to stuff that emotion away. But how do we express it? Can we find a way to express that emotion in a way that's going to be safe?
Absolutely. Now, if someone doesn't have access to acupuncture, acupressure, or even herbal therapies that you mentioned, either for economic reasons or maybe just distance, maybe they just don't live in a close proximity to a place where they offer that sort of therapy, what are some things that they can maybe do on their own?
Well, I think that honestly, some of those self-care tips are the most important. So first and foremost, taking a look at the stress in your life. Are there changes that you can be making to minimize the stress? Oftentimes that's the most basic is, do we really need to be putting that kind of stress on ourselves?
Sure.
And if the answer is yes, I need to be putting that stress on myself, then we need to find some tools to help you manage the stress. Meditation is wonderful. And there are a lot of resources that are available, wonderful books that are available to teach someone what is meditation and how do I do it. Other things are dealing with our emotions. Again, knowing that all of your emotions are okay. They're all right, they're fine, they will come, they're temporary, they will move on. And if they need help with it, there's always therapists and things like that.
So maybe we've recommended this to someone and maybe they're practicing it. Or should they be able to carry on with their regular routine now that they're practicing these sorts of things?
Well, you know, frankly, if someone has practiced these things, they're already not dealing with their regular routine, right? I mean, they've made some pretty massive shifts at that point.
Absolutely.
And a lot of times, my role as a provider is simply to be on that journey with someone, to help them to gradually make some of those shifts. You know, if someone is meditating, if someone is sitting and savoring the food that they're eating, making different food choices, exercising more perhaps, those are massive things, and it doesn't look routine anymore at that point.
Absolutely. So we've really overhauled the entire way that we interact with our environment.
It's huge.
And hopefully created some harmony.
We would hope so, yeah.
So finally, Megan, are there any parting words that you'd like to leave us with on the topic?
You know, I think that in many ways, yes, our lives are hard. It's absolutely true. But I think that as individuals within the society, we have to always remember that we have choices within those situations. Perhaps it's a matter of letting go of something that is causing us undue stress. Perhaps it's taking some time to pause and simply be able to deal with that stress a little bit better. To know that we don't have to be victims of what are certainly challenging situations within our lives, but to just know that they're not alone and they can make some shifts.
Why, thank you for being with us today. I believe that your visit with us has certainly helped create a harmony within our show. So thank you so much, Megan.
Absolutely.
Megan Odell, licensed acupuncturist. We're going to take a short break and then we're going to be right back. These have all been fascinating topics. I certainly feel like I've learned a lot, and I can only hope that you at home have learned as much as I have. So once again, I want to thank all of my guests for being here, Dr. Dan Kessler, Susan Nygaard, and Megan Odell. And thank you to all of our viewers for checking us out. If you have a topic that you may be interested in seeing in a future program, make sure to reach out to us at QCTV.org, where you can not only find this show, but all the rest of our award-winning programming. So have a wonderful day and good health to you all.